I'm happy to announce that we have secured a supply of 5 million bottles of children's acetaminophen and ibuprofen for Alberta families. Right now, your government is working with Alberta Health Services and Health Canada on the details and logistics to import this medicine. And you can feel confident that we are all moving as quickly as we can so that Alberta families can get what they need. And it will be available at your local pharmacy in short order once it arrives. If parents can't get acetaminophen or ibuprofen, then they start looking at other items that are on the shelf. So we know that we also have shortages of allergy medication, and we've also heard antibiotics as well. So they have the ability to produce those. We'll be working with the Pharmacy Association to identify if there's any other urgent areas that we will have to take this proactive step. I'm hoping that with this particular supplier that's been providing European markets, they've provided 55 markets around the world since 1939. I'm hoping that they will be able to assist us if we do end up finding that there are other areas that we need to import more medications.
So in the days ahead, we'll be working closely with Alberta Health Services and Health Canada to expedite the approval process and get this additional supply to Canada and onto Alberta pharmacy shelves and into hospitals as quickly as possible. We ask for your patience as we work through the process. Once approvals are in place, which should only be a few weeks, the medication will be sent to us in a number of shipments. When a shipment is received, the bottles will be available for ordering by pharmacies across the province and distributed within a couple of days. Each bottle will be available to pharmacies at a price that lets them sell it at the average retail price. This is to make sure that the medication remains affordable for Alberta families. Once we have sufficient stock in our pharmacies and hospitals, we will work with Health Canada to determine how we can share some of this supply with other provinces and territories around the country. Our first priority is making sure children get the medication they need as quickly as possible. And I will commit to sharing updates with Albertans as more information becomes available.